But Steve, if you want to sort of tee up the theme for today, because you and I had a conversation about what we respectively have been facing in our organizations, and I'm sure all of you have as well, the calls from the reporters with the rollout of the Affordable Care Act. Everybody wants a patient story, and they want a unique story, and they want their own story. And some of the requests are easy to fill, and some of them are very difficult.
Absolutely. And as Nancy said, we will get the conversation started, and then when Anita arrives, we'll suspend that, although I think what we're talking about flows very well into what she'll be able to inform us about, and then we'll resume after Anita talks to us. Let me first say that ACS-CAN supported a number of provisions within the Affordable Care Act, as I'm sure many, if not all of us, did. We did not support the law as a whole. There were some provisions that we were less comfortable with than others, and there were other provisions that we just didn't take a position on, and we all know it's a very, very big bill. So we have been trying to educate the public and people impacted by cancer in particular, cancer which hits 1 out of 2 men in their lifetime, 1 out of 3 women in their lifetime, trying to educate them about provisions of the law that we think are important to them, that are going to increase access to health care, that are going to give them a better ability to afford coverage, and give them quality coverage at the same time. And we have not been in a position of attempting to enroll people in the marketplaces, though we certainly call out that there are only a certain number of days left to enroll, but we aren't an organization that is out there actively encouraging people to enroll. It's more the enrollment piece is more a part of our educational efforts. And the conversation that Nancy and I had several days ago was this. We at ACS-CAN get calls from reporters here and there, as I'm sure we all do, saying, I'm covering this aspect of the health care law, and I want to ask you guys about it. And it could be that they're requesting a patient whose story they want to feature, and we all know that there's nothing that that exemplifies a particular aspect of the law that's working or not working, or a particular aspect of the health system that's working or not working. Nothing better than a patient story. So in many cases, we're getting asked for a patient story. At some of those times, as well as during times when reporters are calling for other requests, they may just be asking us for comment on a particular provision. But whether or not the reporter is actually asking us for a patient, they're always asking us to respond in the interest of patients, and that's obviously what we want as well. And Anita is probably here now, so I'll just finish off this opening part to say that what I'd like to do a little bit later is engage in somewhat of a conversation about how our respective organizations respond not only to requests for specific patients, but to general inquiries about the law. And in a highly partisan environment around this law, which is frankly unfortunate regardless of which side of the political equation you're on, I think it requires us to be, we certainly feel it requires us to be more precise in our response on this issue than on just about any other issue. And I can explain that a little bit further when we resume. But Anita is here. Thank you so much for joining us. We know it was a trial to make it.
Well, I was telling Merle that I was actually visiting a hospice a week and a half ago up in Montgomery County, Casey House. Had a flat on 270, but whatever it did, the shakeup was such that all the sensors have all been off. I've had that changed, all that. I'm on M Street doing very well today. Very proud of myself because I'm going to be on time. And all the sensors started going absolutely crazy, and the one side of the car, so I'm like, I'm just going to pull over and get in the cab. So I'm glad to be here with you. Overall, I've been asked to talk about the patient perspective and where the media is on that. Just to give you a little bit of background, I was the evening news anchor and a medical reporter at WUSA 9, the CBS affiliate, for 5 years in Washington. Before that, I was at WPVI TV in Philadelphia as a medical reporter there. And then I recently, in September, took the Senior Vice President of Communications position at the National Hospice and Palliative Care Organization. So I've now gone to the dark side, as my journalist friends will say. However, when you represent something like hospice and palliative care, it's not exactly like you're shilling for Pepsi. So I've gained back a little bit of trust on that. But I think the patient perspective is so important. But what you were just mentioning about in a politically charged or biased story, it is very, very difficult, and you really want to be very protective of how your individual might be used. I know the patient perspective lends so much emotion, especially to television, and that's obviously where my default is and where my knowledge base is what you need for television. But oftentimes, that patient perspective is critical to selling a story that is rather complex, as health issues often are. The emotional component can get your editor to look at something, your managing editor to look at something you wouldn't otherwise. And I have a good example of something that happened just before I left WUSA 9. I was really pushing for a story on more research on some of these rare, what are sometimes called tropical diseases that really aren't so tropical anymore, Chagas being one of them, and the impact in the United States. And some of the research going on even within Washington, D.C., and about cases not just maybe migrating in with an immigrant population, but could there be some endemic now to the United States and coming further north. Well, obviously, you know, what promotions wants to sell is that there's this really horrific disease being carried by bugs and it's coming to get you now. And I'm like, wait a minute. No, it's not that. It is important, and a lot of times some of these diseases, because, you know, they affect certain populations, don't get some of the research that others do. But they're like, well, we can still go with this idea of needing more, looking into these types of cases, because it was happening at the same time as some newer cases of tick-borne illnesses in the Southwest. And I said, well, this is a time we could do a whole story on it, but we've got to have a patient. And so I, through the help of Suzanne Folks, and I'm trying to think who else was involved in Research America, we found someone, and through a physician, and found that person. Well, my photographer and I showed up, and she just wasn't there. And then she didn't return my call. So clearly she changed her mind. I mean, this was, she did not want to talk about having a blood-borne infectious disease on camera. Not a big surprise. And it killed the story. We were done. There was no way I could spin it, scary bugs included, without this patient. They weren't interested. So the patient part really is such a big component, and I did share a couple clips with Nancy that I thought really helped how the reporter uses that, or how I think a patient story can be used. Years ago, before the advent of Google, and when I first started doing medical reporting, there was much more of what we kind of would, in a very, cynical way, called disease du jour. You would have your patient, so-and-so is struggling with this. There's a new treatment for this. This is how this works. There is a new surgery for this. Here's this patient before, here's this patient after. And that template still works, but your medical consumer is far more savvy, and the things that they have wanted to figure out, they've Googled. So the complexity of the stories and what is really considered unique and what makes the cut has become far harder. Awareness and things like that we used to do more with. When I was on the media, there's too many, there's too much of an influx of it, and it is a difficult thing. That's why having a unique patient story can help. From a reporter's perspective, what you oftentimes do worry about in some cases, and this was much more the case if I was covering issues related to plastic surgery or aesthetics than harder hitting health issues, is what has been offered to the patient to participate. What what was the deal? And there's definitely some ethical gray area. Is it really wrong if I'm wanting to show someone getting a procedure and that person is allowing me to be there before it starts, be there in there while it's happening? I have video then of the doctor explaining it, and I have the results, and I have the okay that, it's unaltered, that this is what we're going to do. Is it wrong that the doctor may or may not have offered some deal to that patient to be part of the story? That was something that I started to realize the longer I was in medical reporting, to insist that there was no agreement of any kind for me as a reporter. I just didn't. That just became something that was just too difficult to navigate. What I did insist upon, and which some people don't like, sometimes they would be like, oh, well, this didn't turn out the way we wanted. Why don't you just use the video from, the pictures from the company? It's like, no. Once you start this process, or we'll pull the story. You don't have control of that. It has to be the accurate thing. So that was something I would always watch out for, was what had been promised to the patient in exchange for coverage. And that obviously doesn't really fit in this group as an issue, but that was something as a reporter that I became far more cynical about. And then there were always the media tours that sometimes would masquerade as a unsponsored kind of thing, and and they would actually sometimes hide who was behind it so that you would do the story. And it became much more. I became much more cynical about pitches by far than I was earlier on in my career. I think the patient story, though, is so important, and that's the two examples I brought today. One in particular, every year medical reporters have to do something, on the flu. Every year it's just like when you see the people, it's snowing outside, and you know what, guys, it's really cold. You really have to be careful. That same thing every year, and what snow shoveling could do to your heart, or whatever, these stories that just, are so inane, but they're there, and you have to end up covering them as part of being a reporter, especially if you want to get time for your harder hitting stuff that you want to do as well, that I think matters more. But the flu, that's always an issue, and it's an important health issue, and getting out the push for immunization is big. But every year you say the same thing, and regardless, there are complications where people die of the flu. As a reporter, this last go-around, I was like, what do we do to really drive home the message of the validity of the shot, and maybe override some of the questions about it? So I said, I want a patient with a flu clone. I want somebody who's really gotten hurt by the flu. And that was a big ask, obviously. I worked with Sibley because they trusted my work, and a doctor there that I knew made a promise that if you reach out, we'll be very, very respectful to the family. We'll make sure our equipment touches nothing because we're going into an ICU. We'll scrub it down, and I would like to not just tell people about a flu complication, but show them how bad it is. And in a moment we can take a look at that, but that was the clip that we ended up using, was this is what the flu can do. And it was by far the most visited after a period of time on the website because you had somebody who's near death from the flu.
And for those who are on the phone, I sent out an email earlier today with the links to the two stories that Anita is talking about. For those who have just joined us, would you please mute your phone so it will be easier for other people to hear? Also, we are recording this call. Thank you.
And so that was one example for me where the patient completely, and that cooperation with that patient's family really, really made the story. The second one that I brought to kind of show and review was part of a larger campaign and a much easier ask because there was an organization behind it, and it was force, and it was a group of women who genetically were predisposed to breast cancer as BRCA1 and BRCA2 carriers. And we were partnering with them to, as our television station, to do the premiere of the movie Decoding Annie Parker with Helen Hunt, about the woman who first said to fellow scientists, this breast cancer is hereditary. And what we said was we would like to follow someone who is going through the choice of having a prophylactic mastectomy very, very, at some point in her life. In another story, I followed a family where 2 aunts and 2 nieces got the genetic testing because of the breast and ovarian cancer there. We were there as the test results came back. That was a tougher one as well. But what the reporter tries to do is to facilitate these kind of interactions or possibilities with public relations people they trust. Because then there's a mutual understanding that, yes, I will not disrespect this family. I will make sure that this is treated in a sensitive way. The piece that we did with the young woman with the prophylactic mastectomy, I met with her before. We were in the operating room with her after, talked to her about her choice, all kinds of pictures to go with the story, with her mother, all of those things that created a powerful journey for the viewer to go through it. Without her, there really was no story. But it opened up the larger issue of the genetic role, who should get tested, who shouldn't. We did sidebar stories as well that dealt with, I was in the Supreme Court for the case as far as Myriad and genetic, who owns, who can patent a gene and all of that. All of those stories, really kind of were facilitated or helped along by Force, this group. But in that case, you have people who are very, very willing participants who want their stories out there, who have become advocates. So these were 2 very, very different kind of patient stories that I was looking for, and very different in what we ended up getting as a result. But it is a key part of any kind of health reporting. When it comes to the Affordable Care Act, that was really coming out as I was making my transition. So I was there for the Supreme Court challenge. I was there to talk about some of the details coming out of that, the implementation, what it was going to mean for people and what the changes were. But I transitioned out before healthcare.gov launched. And so I was not there for that aspect of it on the reporter side. On the other side now, my push to media, and we're actually getting ready to launch a major national campaign that will be very patient-focused, which will be a very interesting thing for hospice, I think, I hope. But the pushes that I've made now to the media have been around concurrent care. There is a tremendous interest about what is the Affordable Care Act changed, and other than quality reporting measures for hospice is the one really strong aspect of change for patients right now is part of the law is that in the pediatric population, concurrent care is law, meaning if a family has a child with a life-limiting illness on Medicaid, they can stay on somewhat of a curative track, maybe try another round, and Merle, correct me if some of this doesn't sound right, but still stay on a curative track for their child, yet access hospice services. It is not an either-or proposition. We believe that Medicare will be announcing this spring the concurrent care test sites for the adult population. The thought being that this will not be overlapping care, but quite frankly, that if you've kind of already gone on that continuum, it may be easier for you to forego a treatment instead of saying, okay, I'm either trying to fight my cancer or I've stopped that fight and I'm in hospice. Having an easier transition, and I hope that's a good explanation of it. So now I'm on the other side looking for patients for those and examples for reporters that I'm working with to talk about why we believe concurrent care is a good idea. But I'm really interested in answering questions from the reporter's standpoint of the patient and what you're looking for. But I would say the big issues that come up are, again, has anything been promised or offered to that individual to participate? And, because that became a bigger issue for me, that there were a lot of deals being made. And like I said, not necessarily by any means from nonprofits, but more from larger companies, or if it was aesthetics or plastic surgery involved. So that was an issue that became a big one for me. And I think also having individual relationships with the public relations people, I really relied on that a lot, because I knew, which hospitals could get me someone right away who understood what my needs were, but also who understood my reporting ethic and knew that I would treat that person with respect. I think it goes both ways.
Yeah, I was going to ask you to expound on that. At the American Cancer Society, and I'm sure at all the other groups represented here, we encounter patients who are uncomfortable participating with the media for whatever reason, and many times, as we all know, it's because they're just not able to, even if they may want to. But of course, there are times when they are hesitant as well. They fear what might happen. Control. And what I hear and see you doing and explaining is very helpful. You clearly care so much about the topic, and you just emphasize how much respect you have for the patients and how much you show that when you're dealing with them. Put yourself, if you could, in the hat of your general reporter, and what is it that we can do on the other side to encourage a patient to share the story in a way that's going to help others, and at the same time prepare them for talking to a reporter? What is a little bit more about what the reporter is thinking? Because we all know we may not know that reporter. The reporter may, as unfortunately, we all encounter reporters who say they're wanting to do one thing, and maybe it turns out into something else. So,
oh yeah,
you all have that.
Absolutely.
So shed a little bit of light on that, so as it pertains to how we might approach that.
My perspective would be, obviously, with caution, which you guys already seem to, because you're very interested in that topic. And I think with this idea, like, I would ask very hard questions about the parameters of the story and exactly what is it that you're trying to convey here? What aspect of this patient's story are you trying to share? And I personally would be very vigilant if in any way, if that happens where someone tells you it's one thing and then it becomes something else, I would immediately file complaints with that news director, with the GM, with the newspaper editor, and be very, very vocal about that, because I believe there is too much of that. The other aspect, in fairness to many journalists, newsrooms have been cut way back. Post-recession, they are not what they once were. And there is such a demand for getting the story out and getting it out so quickly. The thing that I've also come to realize, being on this side of the table, is with the 24-hour news cycle and web publication, they're asking you for a comment. It's like, but you've already published your story and you're just going to tack my person on the end. So I get that side, and I'm like, how dare you? The thing that I think also is very important is, I think, media training of some kind for who your person may be. And that is not to coach them, but to get them to a comfort zone where they are speaking candidly, but in a comfortable way, about their story, what they want to share, and just as importantly, what they may not. And I think that can be established ahead of time. If they ask you this, but you don't really want to go into this aspect of why you're seeking this fertility treatment, you know, you can just say, I don't really feel comfortable talking about that. But in the heat of the interview, if that hasn't been established ahead of time, it can be very daunting. The other aspect is that if you're looking at a live broadcast of any kind, I would really encourage even more training on that and on the idea of sound bites. And this is not to be in any way cynical, but that if when you are looking at, and this is whether it's someone representing your organization or, but in particular, a patient advocate, having cohesive, formulated thoughts that have a beginning and an end and don't run on is really, really beneficial. It's beneficial for the journalist. I think it's also beneficial for the interviewee because you come across, you just come across better. And when a person runs on, there's a tendency to also get more and more nervous and maybe say things that you don't really want to say. So it's not practicing what you're going to say, but kind of maybe going through it and say, what would you like them to know about you? What did this new radiation treatment for prostate cancer change about your life? You can do that sort of thing, I think, and help shape the person's ability to be an effective patient advocate and maybe also protect them in a way. However, there are unscrupulous people in journalism just like there are anywhere else. But my other thing that I would do, and I plan to, is if someone that I have put forward is not treated fairly or if my organization is misrepresented, I have no problem going above the reporter.
I'd be curious to know, at least among the people here in the room, how many of you have an organized way of capturing patient stories? If you want to share verbally so that the people on the phone can hear what you do?
Well, it's really grassroots, simple, organized way. Nancy, it's almost kind of embarrassing to share. I'm the only communications person on staff for our association, which is national level, and I have people constantly wanting to share. I have no problem having people want to share their stories.
And what is your organization? And forgive me.
Hydrocephalus.
Okay.
Yeah. So people love to talk about their brain surgeries. I don't know. I mean, my daughter has hydrocephalus. I did a piece on NBC Now that like last year, and I was very happy to be an advocate for the condition. So I get it. So they write me constantly, and we also do calls out to social media. But people email all the time and say, I want to share my story. So I have guidelines for what I want them to capture in the story, and I email that back to them, and then I help them work through editing the story, and then I have a personal story library on my server, and then when press call, I'm really easily able geographically to find someone who wants to tell the story.
Wow, that's
About how many people are in your database?
Right now, and I've only been at HA for a year and a half, I think I have only about 50 stories.
Mm-hmm.
So that's enough. Yeah, and then I have people who go ahead and do interviews, and I coach them, but they do them on their own, and then I capture their story that way. So I'll get the story that they've put into the press. So oversharing, I think, sometimes can be a challenge. Like, if you don't prep them, they'll say so much of their story, and then I always worry that pieces might get taken out and misconstrue the condition for a vast majority. Like there'll be sound bites that are really magnificent, from a press perspective maybe. Like, she's had 100 brain surgeries, and that's common for hydrocephalus. That's not common. It's not, unfortunately, it's not uncommon, but it's not common.
That's exactly right.
Like 20 surgeries is common, 100 is not common at the other end of the spectrum. And so then it's kind of like, how do you keep your condition, and your messaging, how do you protect the integrity of that, so that, because I will get people who call and be furious about that, like, that's not what hydrocephalus is about, or that's not true. Like, they're saying that, everybody's going to have a mental or cognitive or educational challenge, and my child's doing okay, or you'll send the other way. Because like, everybody does great with hydrocephalus, and my kid's in a wheelchair, and my child, can't graduate from high school. So I'll see like that happening, and then I, call.
Where I saw it all the time was autism.
Mm-hmm.
Autism was, I rarely made anybody happy with an autism story. From the press point of view, I really didn't, and especially if I did anything, even when it was you know, Institute of Medicine or whatever saying the vaccines are not linked to autism. It's like you know, you're in the pocket. Like, how much how much is the pharmaceutical company paying you? Like, yeah, don't get me started. But autism was another, and again, no matter who the patient was, that family situation, I would sometimes hear from people saying that that's not the broader picture. That child is very high functioning, or you're not showing all aspects of ABA therapy and you just did a disservice. That was one in particular where the patients and the families were very, very vocal and involved, and I found it difficult to report on.
And it's hard when you have a condition that where the outcomes can be very different, and also where the spectrum of who can have the condition can be very different, from a premature baby to a senior in their 80s. So that can, I think, make it difficult. And I was actually going to ask you a follow-up question, but I don't want to, whoever else has a library question to share, I don't want
hear how other organizations are doing, and then we'll come back to your question.
For me, it's actually very, very similar.
Okay. And again, could you identify your organization for people on the phone?
Sure. I'm with the Parkinson's Action Network. So we have a really huge sort of network of grassroots advocates that do work in their local communities. So they love to share their story. I'll do interviews with them for things like our own newsletter. So that's a good way for me to get to know who they are, and then that way, you know, I know when a reporter calls, oh, this person would be perfect. Ours is also, like, our group also does a lot of oral storytelling with either their members of Congress or support groups. So we do a little bit of training around that aspect of it too, and how to sort of very concisely and short, sweet, tell your personal story. So it's not as much of maybe the media asking, because Parkinson's disease is not as, you know, popular, I guess, in the media.
Alzheimer's is killing Alzheimer's crushing Parkinson's.
Unless like Michael J. Fox is doing something, you know, we don't get that many, we need a Parkinson's patient for this story kind of request. So we do a lot more of the, how do you orally share your story in front of a group of people for whatever reason.
We're doing more or less the same with our newsletter. We're doing a lot of outreach to patients.
And your organization?
I work for the Lupus Foundation of America, and we're doing, so we do a lot of outreach with our newsletter. One difficulty that I have is that because we have so many chapters, if we, for example, get someone from a specific area and they're connected to a chapter, we have to go, it is a lot more difficult if our chapter is not receptive to having someone who, you know, they're claiming from, you know, from Georgia, for example. We had like a Miss Teen from Georgia interested in being a spokesperson, like a national spokesperson, and so we could use her for media, and she's very good at speaking, so obviously that sounds great, but it's perfect. But because of that, so that's something that we have difficulty with all of our chapters, maybe not being as interested in using someone who, you know, works for their media, but we collect our stories more now, so every newsletter we have a patient story, or we try to, and I feel like I have a lot of difficulty getting so much sharing, like you say, like on social media, or they're sending me very long stories that they want to go into the newsletter. So we haven't been doing that previously, and since I just came on at the end of August, I've been really trying to rally that and make it more interesting, because we haven't been getting that many patient stories, and when we do, like on Christmas Eve, someone asked for a patient story, and my Christmas Eve became very different that day. Just really trying to, it's just very stressful, especially when there was just, you know, 3 of us in the office that whole day trying to get someone. So for the most part we are, but when it's so specific and they want someone with lupus, and they want someone from this area, and they want, you know, this age range, and they need to be this race, that's like, okay, and they need to be able to speak on camera. Okay, let me see. So for that, I think getting patient stories in writing is a lot easier than getting people who are going to be interested in being live on camera. So we got someone to do like a walk and also talk about ACA not too long ago, like that in November, and that went well, and that has also progressed for her to be in Essence just about a week ago, and then like an interview with some other people, which is great, but we only have like a handful of those. So for getting the patient stories is getting a lot easier now, but getting people who we can have ready at a drop of a hat and seeing how well they're doing to talk to media for the rest right now is difficult. But
And speaking on behalf of the National Health Council, we get lots of requests from reporters, and so you've all seen our emails saying, please, we need a reporter, and of course we need it tomorrow, today. A lot of those requests are for very specific issues, not come and talk about my condition or my disease or my recent surgery. It's, okay, talk about it as part of a bigger, broader story having to do with the Affordable Care Act and implementation, and that's, of course, where it's doubly hard for many of your organizations. You were about to say something, but then, Steve, I'd like you to comment on it because you've been on the receiving end of this process. Go ahead.
No. I was wondering about that and how is that really does complicate it, and how people are dealing with that issue with the Affordable Care Act, because there's so much spin going on both sides.
No doubt about it, and it's not easy for any of us to do. We know that a particular story can only profile one or two patients, maybe, and the patients, as we said, personify an issue that we're seeing in the system. I think the real challenge for us is contextualizing the problems that patient might be facing. Let's face it, the media isn't calling us for success stories very often. So it can be easy to fall. It can be easy to support the approach of a reporter who's looking to take an issue with the health care law, and there are many of them, and make it seem like the most important issue that there is. And there are, if you count up the number of stories we've seen, there are thousands of those issues. The concern becomes, from my part, and I think it's a challenge for all of us, is not to lose the emphasis on how the healthcare law is helping people. So in the case of cancer, we get questions all the time about patients who can't get their cancer drug because it's not on the formulary, it's not, or it's on a tier that's too high for them to afford, or any number of other issues. And they'll call and say, can you find us a patient or patients who've had trouble finding their drug? Well, eventually, we haven't seen a lot of that yet because it's still so early. Eventually, we may have real-life examples of people who haven't been able to get their drugs. That certainly figures to happen. But we also know that highlighting a very legitimate issue could inadvertently contribute to that issue being blown, frankly, proportion when you compare it to the benefits that same patient is getting from the Affordable Care Act. Let's not forget that they've gone into the marketplace and been able to look at that they're probably paying lower premiums than they would have as someone with a chronic disease in the individual market. They've got an out-of-pocket maximum now. They've got essential benefits. They've got a summary of benefits and coverage. And it's been very, very challenging on our part. And that's why I said at the beginning, Anita, just before you walked in, I think the challenge then becomes for us, and certainly Alicia, who's on the phone, and I and others in our organization talked about, being more precise even than we normally have to be in answering and contextualizing what this problem is. Not only what the problem is in relation to the benefits that a patient may be receiving under the health care law, but how to fix it. A lot of times reporters will end the quote by saying, this is a big problem for patients. And you're kind of looking at the ... and thinking, well, what did they say after that?
Yeah.
Is that necessarily a problem with the law, or is it an issue with plan design in the marketplaces? Is it an issue with the marketplace board in a given state, and how they've kind of constructed their marketplace and how it's going to work. Is it something that the state insurance commissioner ought to be addressing? It's very easy for reporters, and I don't mean to make reporters out to be lazy. Some are, we know that, but they also have limited space. They've got to tell a very complicated story in only a few words. But it's sometimes easy for reporters to leave the reader with the conclusion, I think that many of them draw, that, oh, this is another problem with the law. Well, it could be a lot more complicated than that.
So what is our responsibility then? And I'd be curious if anyone on the phone wants to chime in, just unmute your phone and please offer your thoughts. But so what is our responsibility? Because we're all pushing to try and grab those stories and get good ones and have it ready and be as responsive as possible to the reporters, but likewise serve our organization to make sure that the patient's story is not misused, abused by the reporter. So what should we be doing differently? Anything? How can the National Health Council help you guys?
So I can share one example. Faster Care is a little bit unique in this space because we're disease agnostic. We focus really on improving and streamlining the medical research system as a whole. So which is a tall order, right? And it's a little bit harder to explain. It takes too long, 15 years, and it costs too much, $1 billion to get a therapy from lab to market. And why is this a problem? So we're really further upstream on the R&D and not kind of deep in the ACA space. But we did a really interesting, we called it sort of a social media experiment last year. That I think some of you may have been familiar with. We called it Time Equals Lives. Saving time in medical research means saving lives, and it was a collection of patient stories from all of the different disease communities that we work with. These are not chronic diseases, but primarily sort of the deadly and debilitating diseases, and a lot of the Center for Philanthropy, the foundations that are funding innovative research, and we were collecting mostly via Facebook and Twitter, and like you, we didn't have trouble with people wanting to tell their stories. These are people activated to sort of bring attention on the national platform for medical research. And when we collected these stories and we created timeequalslives.org, where it was just open source, people could take information. Some of them were, short, videos, a minute or two. Some were, brief written pieces. Some were photos and images and photos and quotes. And the idea being it was timed really around sequestration. So, a year and a half, 2 years ago, looking at let's make sure we're bringing attention to, resources and, for medical research as part of this discussion, and we found that it wasn't in response to a specific reporter question, we need a story, but we found that we became a resource for sort of information about understanding how, what the problems were in the system, and we've, it was a timed project, so it's not something that we're actively, continuing to do, but we realized that the patient story is the most effective way to explain the fact that medical research as a system is broken, because that doesn't get communicated unless you're already a patient and dealing with the system. But we found that was a really interesting, way to do it. It started out just through, crowdsourcing among the audiences that we already, worked with, and that we were sort of a clearinghouse for that as a neutral convener. But that format was interesting, and then,
I might suggest a couple of things for National Health Council, and I would definitely be interested in what people think of these ideas, and then if people suggest others. I'm certain there are groups here at the table or other groups that we all kind of check in with on occasion. Lisa and I do this as well. Hey, what are you saying? How are you guys putting it? Have you heard from this? Have you heard from this report? Okay, what are you going to say? We may say similar. I think it's very useful for the National Health Council to make our community aware of reporter requests, especially in the case that a patient is needed. What I think would be really helpful, and again, I think others should weigh in, is an ability beyond the send to have some discussion or to invite anyone who may reply to the message to ask other groups, hey, what are you saying? Or what do people think if we're putting it this way or that way? I don't think we are protective enough our response to reporters is intellectual property. I think that could be very helpful. There were, I definitely don't mean to do too much talking, but just two things. One, you had sent out a very useful query about a reporter, I forget who it was, looking for a patient story who couldn't access drugs, I think is what it was. And this has obviously been on our minds, and what's helpful, what the National Health Council can do that's helpful, I think, is provide some context and or facilitate some quick discussion about, hey, how might we respond to this? That's not to prescribe an answer for anybody, and it's not to suggest that any two of us are going to answer in the same way. But we all know that we have to respond to these inquiries very quickly sometimes, and we don't always get to think, to do all the research we'd like. The reporter, we don't have an opportunity to school the reporter in many cases. So that sort of interaction would be helpful. Another example, and I think maybe it was you who I talked to, was a seemingly innocent query from a reporter who actually we had heard from prior to you guys sending out the email, who we knew and were somewhat surprised by was taking a pretty sharp-edged approach to the issue. And in that case, it was simply a word of caution to anybody not to avoid responding to the reporter. Again, I'm not speaking in a prescriptive way at all, but to say, hey, you should probably know that this reporter, at least in a conversation with ACF CAN, was pretty set in a certain direction. That may be the same in your conversation, may not be. So the facilitation of additional discussion and opportunities for exchange.
I think that's absolutely, and that's a wonderful way that you can help facilitate that because and get that message out, just so that people are aware that if there's someone who's coming in with an agenda, we're dealing with that right now within the hospice community, with in particular with a reporter looking at it and only looking at one narrow aspect of that and not looking at the larger issues that might impact end-of-life care and only looking at something from the sense of trying to ferret out bad actors or fraud or the like. But how do you then, but I would say the first time that reporter called, I was nowhere near as savvy as I was the second time around, as far as what his agenda was. And I've been working with our state groups, and also, but what's interesting is that our communications people around the country are calling me and saying, he's called us, he's asking this, he's asking very, very specific questions regarding even individual patient stays, and and it's like, well, whoa, that's just crossing so many lines. But that is something that if you know that, and it may go to someone who is looking at different organizations trying to create, well, look at this pattern, or if that's their agenda, knowing that ahead of time. This is a different example because that's to our community. But if you know that someone has that kind of an agenda, I think it's very important to share. And what really is resonating in newsrooms right now, and it's in that kind of the idea of investigative journalism, uncovering something bad happening, which is very important, and it's a key tenet of journalism. But sometimes there is a tendency, like you said, look at this, this is the patient problem. Well, no, it may be one of several, and there may be different nuances to it, and it's not that cut and dry. And I think that reporters do, especially, I know from the sense of television, there is oversimplification because of time constraints. And it's not that simple. And that's just it. And putting context, and when you can, I think, in the conversation, talking to the reporter, like, oh, I found this person for you, but I just want to make sure you realize this and this and this, and this is this aspect of it. But even if you can have that conversation and shape it a little bit, I think it does. It may not help, but it's better than not saying that and trying to say, well, just to put this in perspective for you and how this all works.
Yeah. And even being able to say, you know, if in a quote-unquote normal political environment, we might ask Congress to try to fix this aspect of the law, but we know that this is anything but. So, yes, we're pointing out the problem. The solution is not that simple. So here's what we are. Other comments?
One thing I don't do currently, but now I'm thinking maybe I will go back and start doing, that might be helpful too, is sort of identifying a core group of folks that you work with on a maybe more regular basis that you can just call up or email and say, hey, is it okay for me to just like out of the blue one day come to you with a media request? Will you be open to that? So that you have them on hand, because I think what happens often is you think of the right person, but by the time you email that person, and then that person doesn't check their email until that night, and then the deadline's already gone. So to be able to say, I might just call you on your cell phone one day and say, a reporter out of this city wants to talk to you, is that okay? And that way when they see your name, you know, your name pop up on their cell phone, or when they see your email, they're more prone to sort of think, oh, maybe this is important, or maybe this is timely and I should pay attention. So that's just something I might go back and do right now after.
It's interesting. I followed a patient through the deep brain stimulation surgery with Parkinson's and looked at all of that. But it was, and she had been, you know, identified, you know, ahead of time as a young mom, and we were there with her as it was actually turned on, and we could, you know, see the difference and all. I mean, it was a great story, but that took, I'm sure, a lot of work to find that person, this, you know, young mom who lives out in Leesburg, and, you know, we were there, you know, when they, and then we were also there when they were right before the surgery, when she was off all her drugs. And that was really, really tough. But that's my bent, or my preclination, or I'm not using the right words here. I love that aspect of it, the reality of medicine, and the fact that everything is not like, wow, yeah, okay, somebody's, like, it's a cure or not, is how so many, you know, journalists try to look at things. And it's like, well, you know, did she get better from this surgery? Yes, but it's not perfect. She still has tremors. She still is troubled by it. They had to adjust it. They had to go back in and do that. And I don't think that gets portrayed enough, is the complexity of it. And it is hard. And I can imagine, I now see coming to this side, it's frustrating because you're like, look, this story is there and it's really good. You don't have, but you just have to pay attention and tell the whole story. And I think it's very important with the Affordable Care Act so that it's not utilized as kind of a weapon against the law.
You know, it kind of deviates a little bit away from the ACA, but it goes to this kind of bent of investigative reporting that you were talking about, and sensationalized statements or headlines, or, you know, uncovering the golden nugget. And I don't know if any of you guys face this, but I feel myself falling into the trap of, even in myself when I'm writing press releases, just to try and get any kind of attention for our community and get a reporter to pick up our story, catering, like pandering to that, those sensational type headlines, and, you know, about our condition and our statement, like the treatable form of dementia, you know, experts in brain, you know, function decry, you know, blah, blah, blah. And so I'm using that kind of language to get the attention of reporters. How, when you are a small condition or a condition that people aren't paying attention to right now, and it's not your awareness month or whatever, and if, you know, ACA is not hitting you maybe the same way, how do we pitch our stories to press and get them to want to take up the cause? Yeah. It's so hard if we're small. People can't even pronounce our condition. You know, I have people call and say I have hydrocephalus. I'm like, you don't.
No, you don't. I do think there is something to trying to forge friends in the media. I think that, and not unduly influencing, but people, you know, right now, one of the things that I try to change or maybe shape a little at HPCO is, okay, first of all, have to be responsive. Like, there is no, we can't be an association that, you know, you get back to them the next day. That's not happening. You can't bury the lead. You have to have strong leads, but the overhype doesn't really do it either. I think the personalization of the lead, whatever it is putting it in that personal perspective gets attention. And what I've tried to do, so even when I've had reporters call, about the Affordable Care Act and, what does it mean for hospice and whatnot. Okay, so it really doesn't mean that, it's not changing the hospice benefit or something like that. So what I've tried to do is talk a little bit about concurrent care and say, I can find you, and I've been putting the feelers out in the pediatric population and also among private healthcare providers like Aetna who've done it in the private sector. So to have some stories to go with that. But what I try to then do is say, okay, so this is just one example. There was a writer who wanted something on, the Affordable Care Act, and he wrote for Forbes and Chicago Medicine, and I got him the quotes he needed, ended up doing some of the legwork for him, unfortunately, but got it together, and then I'm like, by the way, I'm launching this campaign, and next year, I'm like, I really can't talk about it right now, but I just want to put that bug in your ear that, or this is going to be coming out. He's like, and so it's literally over the holidays, so I can totally relate, but I've got my cell phone, and there was a slow day, and he's like, listen, if you can just give me some quotes about what you're doing, I remember, and get me pictures that match this, and get me a graph. And I'm like, and it's okay. It was front page on Forbes, on the web, but front page on Forbes New Year's Day, and it was the most read at that time about this. So it's a pain. But I think building those relationships, it's not easy, but I think, and I'm trying to do some of that, actually, it would be great to forge some of that with AARP and Alzheimer's, because that is such a good fit for us, but it's not always easy to do. And writers who, maybe go after some health blogs and things like that, because there's a lot more demand for content than there used to be in that venue. The other aspect is looking at production of educational videos, because some of them, it may be an investment that's worthwhile with a smaller company, because you're looking at the ones that have good educational video placement. Your stuff may end up on Huffington Post, on Yahoo. There's all of those places that want content that doesn't look like it's bought content. So that's another aspect. And there, if you have someone who's been in that story, they've already been through it. You see what I mean? If they've been through like that then they're so much more comfortable the next time it comes around. So that's another thought of just even doing that for your own website and whatnot. I don't know. There's just I think too, if you have pictures and any video to go with it, and this is the last point I'll make on this, we have the We Honor Veterans program, which is tremendous, which is pairing up, to making sure that hospices, if they have, they really honor veteran service. There are pinning ceremonies, choirs sometimes come. We're actually, I just sent a camera to be filming a vet in St. Louis is getting his high school diploma, and the hospice made that happen because they realized he hadn't gotten it. So that's part of my, so I got to NHPCO, and I'm pitching, We Honor Veterans. I'm like, okay, guys, we just can't talk about this program. Where's my picture? Where's my, I need a vet who came in to the World War II Memorial. Where's that picture? Find it for me. And then sending out that pitch with the picture or a video link, I think helps so much. Because even if you're looking at print, they've got to populate their website. And so we ended up, we got Fox News and then Defense News. Defense News was more through a private contact of mine. But we had the video of these, pinning ceremonies and a volunteer going to visit a veteran who was dying, who's older, and then for Fox we used the pictures to say, I'm like, look at, I know who my audience is, super patriotic. You really have to do this story, and very conservative and blah blah blah, but then last minute it's like, okay, we'll have your CEO on, but I need you to find a veteran who is a hospice volunteer. tomorrow. We're filming. We're on live tomorrow. So, but then it becomes mobilization. It becomes reaching out in every way possible, because we're not going to not have that opportunity. We will be on National Fox. We will. We will find this veteran, and then I called him and sent a car for him, and we media trained up until the moment he went out into the studio.
So it sounds like when you say personal connection, it's not just emailing your press release or first of all, distributing your press release out through PR, whatever, and then emailing a press release to people. It's really that personal email that's attached in there with a personal collateral.
I don't think the PR news web really, I don't think you get the pickup. I don't know what you guys think, but I think I literally, for our We Honor Veterans pitches, I wrote a template, went into our Meltwater Press database, and then started pulling out, and I emailed CBS in New York, and then try to use any connection I had, even through my previous TV, to try to get to somebody. And that's a gift, but I'm saying that the personal email versus it coming in a press release, I think, because there's just too many anymore.
You'll get on the Sacramento Bee site, I guarantee you.
Yes, right.
Right?
Every PR newswire thing we've ever done, but it's limited. We are running out of time, and I know that Nancy has some announcements to make in closing, but let me just say one other thing, which is, and it's probably a topic for another time, but is the vetting of stories. It's knowing the patient who you're going to put before the media and making sure that you have covered the waterfront with them in advance, so you know what they are bringing to the table, not only as it pertains to their own personal story, but how that story interweaves with the law, if the ACA is the topic, but this is really applicable to any time a patient is requested. In the context of the ACA, we've seen plenty of instances so far, because it's been politicized, of one side or the other using a story that maybe didn't pan out in the way that they thought. The last thing we want to do is for that, and I think we could all learn from each other on that as well. But a topic for another day. Nancy, do you want to close?
Just two very quick announcements. Only 19 days left to enroll in a healthcare plan through the marketplace. A reminder, please go to www.puttingpatientsfirst.net to use our out-of-pocket cost estimators. Share that site with your members. Use one of the buttons we've created. Share the link. Let's do all that we can to try and help our patient community find the best plan for each individual that meets their health and budget needs. And mark your calendars now. Our tentative next affinity group meeting is Wednesday, October the 8th, again, 2:30 Eastern Time, and we're open to any ideas, suggestions for the meeting topic. And with that, thank you all. We have one more quick
that Steve reminded me of that we just talked about today. The American Heart Association and ACS CAN and Autism are doing a Twitter chat with patient stories being the focus. I think we settled on the hashtag ACA chat, but I'm not sure yet.
I'll be glad to send it out to you.
Okay. And it's the 19th between 2 and 3 Eastern.
Wonderful. Thank you all. Look forward to getting your suggestions for the next meeting topic, and have a good afternoon.
Thank you all, and thanks, Anita.
Yeah,
Thank you.
Bye-bye.